Hello everyone, welcome to BS9 We Are Not the Same. We are here in Dr. Paul Campbell DDS office, and I'm speaking so softly because we have patients. We don't want to disturb anyone. But Dr. Campbell has been phenomenal in the community. He's done some amazing work for the last 30 years here in Westchester. We would like to honor him. We would like to take some time to get to know this doctor. BS9, we are not the same. Another one on this truck, proving that we are not the same. Dr. Paul Campbell.
I was actually born in Toledo, Ohio, so I'm from the Midwest.
Oh, you're not from California?
Well, we moved out here when I was 4, so I'm in California before.
Oh, okay, well, yeah.
I pretty much grew up out here.
Yeah.
Went to high school in the South Bay, and then went to UCLA for college.
You see a Bruins.
I'm a Bruin.
They just won.
So Bruin for regular college and dental school.
Oh, wow.
And then I left after 8 years and went to do a residency in Boston.
In Boston. Oh, I lived in Boston.
Okay, yeah. So
Yeah.
Boston's a nice
And the
city.
cold
It's a
weather.
great city to visit.
Yeah, but
I wouldn't
Boston.
want to live there.
I'm not gonna say too much.
I was
It's
there
cold.
for 2.5 years.
Wow.
So I had 2 mild winters actually. Got lucky. And
Yeah.
I knew I was coming back. So then I came back and opened a practice here in this building with another gentleman, another doctor. He's since moved to back to Michigan. So
I see.
I stayed
Oh,
and
wow.
kept there. We expanded over the whole wing.
How big is the office?
Well, there's 6 operatories.
Oh, wow.
The square footage is.
No, that's okay. I just 6 operators. It's actually quite impressive. Now you are
I'm a periodontist, a specialist.
for those of you who don't know how to spell that, BS9, we are not the same. Can you spell periodontist?
So, which is gum specialist.
There you go. That's nicer.
So we
Yeah.
take care of gum disease, implants, cosmetics.
We like cosmetics. You know, there's so much to talk about, what you do. I'm so interested in it. But that's for our part 2. Don't forget, next week we have more with Dr. Paul Campbell. But I think what got me so interested about what you do, who you are, is what you've done for the community and your work, your benevolent work. I heard some things about you.
We don't
Yeah.
discuss
We
all
don't
that all the
discuss about
time.
that all the time, right? Why?
Well, I like helping people, helping the community. We try to be fair with people, and I won't say so much pro bono, but here and there I have to take care of some people that can't quite come up with the right amount of funds.
Amazing. I always like to use the saying that I was told by one of my bishops. When you give to givers, the cycle continues. And when you give to takers, the cycle stops. And you're a giver, you've given to so many people, you give it to me. And I'll make sure that cycle doesn't stop. But, I also know that you've traveled, right?
I've done quite a bit of traveling.
Tell us a little bit about that.
Oh, okay. I pretty much traveled around the world, per se. I've been to South Africa and Northern Africa. That was probably one of the highlights.
Africa.
Been all through Spain.
Hola mi gente de España, ¿cómo están?
As a matter of fact, Barcelona was one of my
Barcelona,
favorite
wow.
cities in the world.
Yeah, I lived in Spain, so.
Oh, yeah.
I lived in Spain,
So,
yeah.
So we're in Spain, went down to the southern border, Rock of Gibraltar,
Uh-huh.
and then took the ferry over to Morocco.
Oh, well,
So that's my
you
northern-
have been everywhere. Oh, I'm just giving everyone a little bit of next week, but how has the pandemic affected you?
Well, I'd like to say that we were closed for a while.
Oh, wow.
So from mid-March to the end of June.
I see.
we were closed.
For
I came up here myself
Mm-hmm.
to take care of some emergencies.
So wow. So I always wondered about that. If there was an emergency, what does one do, especially
Well, for my patients,
medically?
they were lucky because if they called
Uh-huh.
and they were willing to come out, I was here.
Amazing.
So I treated maybe 2 or 3 people a day. Maybe some days would be none, and I would just answer the phone. I was calling patients, just letting them know that we're closed for now, but
Yes.
let's reschedule for. But we were putting people out like 3 and 4 months, and luckily, once July 1st hit, we were able to open back up.
Open back up.
The
Yes.
CDC gave us all the parameters.
Amazing.
To reopen.
Mm-hmm.
So we got everything done with the air filters and the plastic,
Yes.
the guards, and,
Yeah.
what have you, and all the PPE. So we had to wear goggles,
Mm-hmm.
N95 mask,
Absolutely.
then shield,
Yes.
gown, double gown. So it was,
Wow. No,
so it was like a hazmat suit.
no, I was just gonna say that because I think when you think about the medical field, I think what you do as well as anesthesiologist, I think you're so close to.
Oh, yeah, right.
So you
right there.
Yeah.
So it was a blessing that no one got sick through that whole time, and now we're all vaccinated.
We're all vaccinated. Well, we'll touch on all of that later.
Okay.
But we're in this special room, where I believe all over the world, it's not quite placed like this, and you've traveled. But tell us a little bit about your most important items in here.
Oh.
Why do you laugh?
So
I recognize this.
Yeah, well, I guess that's the most important thing. That's where the patients sit and get comfortable.
May I sit? Okay.
So the good thing about this room is everybody always comments that when they look out, they feel like going somewhere because they see the airport.
The airport is right there. BS9, we are not the same. We're in the city of Westchester. And the airport is not far. Dr. Campbell is showing me around, but the view is spectacular.
Yes. We have beautiful sunsets right on over there.
Oh, I can imagine.
See us,
It doesn't distract you from work?
No, because I'm used to it. But I mean, I glance out here and there.
Okay. No, but I was watching, actually I was in a training where I heard so much about what do you do when during the pandemic there's lack of electricity or there's lack of certain supplies.
Mm-hmm.
How does one, overcome those kind of challenges?
Well, without the electricity, you have to have generators.
Mm-hmm.
And then the water we were pumping in. We can pump in the water. But we use a lot of sterile water and saline.
Yes. Mm-hmm. Mm-hmm.
And so that's, luckily for us, that's bottled.
Okay.
And then most of the instruments that we just use by our hand instruments.
Yeah.
So it worked out. So we were able to function.
That's gorgeous.
Pretty much, it was a ghost town.
Well, I can imagine. I think because of some of the benevolent work that you do, my mind is taking me to an area where, let's say, you went to help a rural area. How do you take care of children?
Unfortunately, a lot of the time when we do the kind of missions,
Have a seat, doctor. Look, yes, we're not the same. I'm in charge here.
We do the medical missions. We use pretty much the generators and all our hand instruments. So it's we're roughing it a little bit, per se. So we have air generator. As long as we can get air pressure, we can use our drills and what have you. And then a lot of the things are extractions.
Oh, okay.
So
what do you mean extraction?
Well, I mean, you'd be surprised. People have, underprivileged. They don't have a lot of dental procedures.
Yes.
And so the teeth are rotten and they start hurting. So they're even happy to just get them pulled. Not all of them, but the ones that are no good pulled. Now there's other projects where when we go to the Dominican Republic, we place implants in the people. They line up droves to come in. So they get the implants and they get the teeth put on later. It's a fantastic program.
BS9, we are not the same. I said it was a prelude to a conversation with Dr. Campbell, but we are blessed to have powerful people like Dr. Campbell DDS who travel the world to help the globe. So, I want to ask you so many questions,
So
but
we're on a roll now. So.
We're on a roll. We'll continue this, right? But my question is, when you travel, do you take a team? Do you go by yourself? Do you find people there? How does that work?
We usually take a team.
Okay.
We'll take a team.
Okay.
So one of the teams is from UCLA team.
No way.
From
Okay.
School. We'll bring dental students.
Yes.
We bring auxiliaries.
Nurses.
Yeah, the auxiliaries, the dental assistants, what have you. And that's been very easy to do and very rewarding. The students get a lot out of it, we get a lot out of it, and the people get a lot out of it.
Absolutely, I can imagine.
But we take a team. We don't just go, without supplies.
No, of course. So the preparation, how long is that preparation for you to take a team outside of here?
Well, the lucky thing is we've done it over the years, so, it's just a matter of getting everybody with the time. Right. So usually the time issue is the biggest thing. So we get everybody together and then we gather up the supplies that are just stored and made for this, or a surplus of different things.
Amazing. Well, I think with what you've done for the community and for even for your career, what kind of legacy would you like to leave for everyone?
One thing I like doing is helping the younger dentists that are coming behind us. So that's one of the benefits that I have of being faculty at UCLA. I meet a lot of the younger dental students, and I had them come and what we call kind of scout and around the office, and the shadow.
Oh wow!
And they learn a lot. They see what they like and what they don't like.
Yes.
And some of them we let them come and work.
Yes, absolutely.
So and then I even go further back with the pre-dental, and we help them too.
You just touched on the subject as I'm talking to you. My mind is going. I'm thinking of pre-dental because I think when anybody's growing up, sometimes you don't know exactly where you're going to go until later on in life. You're like, oh, I didn't know I had a passion for this or for that. So how do you start at a younger age to guide people from our community mostly?
Exactly.
And some kids in the world who might think, well, you have to have certain equipment to be able to do what you do.
Right. So fortunately, I'm in another couple of organizations that go out and mentor young men.
BS9, we are not the same. A prelude to a more in-depth conversation with Dr. Campbell, DDS. Dr. Campbell, what are these two items that you gave me?
I gave you the mirror. You can look inside the mouth, and the probe, which probes around each tooth and lets you know where there's.
Oh, that's that tool that they put in your mouth and then they go 5, 6.
Exactly.
I knew something. I am a real nurse. You don't know. But thank you so much. I'm so excited. I think this is going to be the opening to another educative conversation for the world. But did you like? What did you think? Tune in next week to see what we have in store with Dr. Paul Campbell. BS9, we are not the same. It is your oral health. It is your health after all. After all, health is wealth, right?
Sure.